Hi everybody, Dr. Eric Cobb back with you again this week. I have something that's on my mind. I have a little bit of a concern this week, and it's based on a study that just came out that I want to share with you. And this is not just to point at this specific medication that's involved in the study, but to basically remind us that the human body is very complex, and while it seems like there are lots and lots of experts out there about how the brain works and how the body works and how all of it's meshed together, the fact is that we're still pretty much learning as we go, because medical science, while it is advancing incredibly quickly, we're just beginning to scratch the surface of all the different complexities of how really we're built and how we perform. So let me give you this story here. Just a couple of weeks ago, a study was published, and it looked at the impact of certain medications on exercise. Now, the medication that was in question is one that I have a big interest in because I've seen issues with it over many years in working with different clients. And it was actually testing the impact of a statin drug, and if you're not familiar with statins, in this particular case it was a generic, what's called Zocor. But statin drugs are given to people who have been determined by their physicians to have cholesterol that's too high, or the ratios are messed up or whatever, because they're trying to prevent a heart attack. And whatever your belief systems around that, I just want to talk about what came up in this study, because it's something that I want you to consider either for yourself based off your own medication use and history, or secondly, about people that you know, because I can virtually guarantee you that everyone knows someone that's on one of these particular medications. Now, here's the story. What they did is they took two groups of people, they brought them in and they looked at them, and the group that they included in this study were people that were kind of, in essence, very normal Americans. They were a little bit overweight. They had a couple different risk factors for what's called metabolic syndrome, the beginnings of diabetes and heart disease. And so what they did is they took them and they split them into two groups, and they had them exercise. Now, they had one group that only did exercise, and the other group they did exercise plus they gave them a fairly standard dosage of a statin drug. Now, the goal was to see, do the statin drugs enhance or hurt the effect of exercise? And remember, they're trying to give people these cholesterol medications in order to prevent heart disease and premature death from heart attacks. So what they did, like I said, is they broke them into the two groups. They exercised for 12 weeks, 5 times a week for about 45 minutes. It wasn't super intense. It was either walking or low-grade jogging on a treadmill. And at the end of the 12 weeks, they went back and they tested them again. Now, here's where it gets really important to hear the results. The people that were only exercising, no drugs involved, actually had some really important increases. Their cardiorespiratory fitness increased by about 10%, and the markers that they were looking at within the cells, because you have these little things in your cells called mitochondria that are responsible for energy production, they found that the energy production capacity in the people that did just exercise alone went up by about 13%. So better fitness and better energy production at the cellular level. Then they came to the group that did exercise and took the statin drug. This group over here did not get good results. In fact, their cardiorespiratory fitness went up about 1%. 10% here versus 1% here, and in fact, some people in this group actually lost fitness. And then when we looked at the enzymes related to the energy production in the cells, remember the exercise-only group went up about 13%. On average, the people that were taking the medication and exercising actually lost 4.5%. Now, this isn't just kind of a small concern, this is a big concern for all of us. Because as I'm trying to point out, we don't yet know really the impact of the different medications that we take on our health and our fitness. And so what I want you to take away from this, number one, is if you are on a statin drug or someone in your family is, and you're exercising and you don't feel like you're getting the benefits of exercise, you may want to speak to your doctor to go, hey, are there potentials here? I would never tell anyone, if I don't know you, I've never worked with you, I would never tell anyone to change medication without speaking to their physician. That's their job, and that's their job to help you monitor that. But the other part of this is it's your body. And if we look at statistically, statin drugs in general seem to decrease heart attacks in people by about 20%. Improved cardiorespiratory fitness, even by a small amount, can be preventative at the 50% level. So the question becomes, what can you do in your lifestyle? What can you do in cooperation with your healthcare providers? At the end of the day, you have to realize that everything you put into your body, whether it's food, which is really the biggest drug that we take, or what you drink, or what your physician's given you, or the vitamins that you take from the health food store, whatever it is, they all have potential impacts, and we're just learning what those are. So you have to be your own scientist a little bit and really pay attention to, as I'm beginning to do different things in that world, how does it impact me? How does it impact my energy? How does it impact my fitness? Do I notice differences? Am I more fatigued, less fatigued? If you can think back in your history and pay attention to this and write it down, you can have much better discussions with those people who are involved in your health and fitness pursuits and your medical care. So that's my encouragement for you this week. Pay close attention to this kind of stuff. We're going to hear more about it as time unfolds, but because it's your body and your health, I really want you to take that next step of being in charge and paying attention. So I hope this is encouraging to you and useful for you, and please feel free to share this one around because I think it's very important information. Thanks. I hope that you have a fantastic week. I'll look forward to talking to you again soon.